This is a recording for diagnosis coding for the chapter on infectious diseases. Looking at the beginning of the chapter, we talk about coding infections and viruses and like things. The one thing you need to know about coding infections and viruses is that if your medical record documentation indicates the organism that is causing the infection, you need to code that organism as well as the site of infection. So sometimes you can get the site of infection and the organism name in one code, and sometimes you will need two codes, one for the infection site and one for the organism. So let's take a look at an example of this. If your infection site or infection is pyelonephritis, which in the index is on page 270, and it's pyelonephritis due to diphtheria, you would find the main term pyelonephritis and then go down to the subterm in or due to. And let's say your medical record shows that the organism is diphtheria. You can use code A36.84, and that code would represent both the site of infection, the pyelonephritis, and the organism causing the infection, diphtheria. Therefore, in that one code, you have both things covered. But let's say your medical record documentation is pyelonephritis due to Escherichia coli or E. coli. If you look under pyelonephritis as the main term, you do not see E. coli or the Escherichia coli listed. So in this case, you would sequence the pyelonephritis code first, and then you would sequence the organism code second. And how you would look up the organism code is through the main term infection. So you go to the main term infection on page 183 in the index. On the left hand column is the Escherichia E. coli code, and you are going to use it as a cause of disease classified elsewhere, and that would be B96.20, and that organism code is listed second after the site of the infection. Okay, so you try to wrap it up in one code. If you can't, you use two codes. Typically, you sequence the site of infection first and then the organism second if you need the two codes, unless your code book, your index, or tabular instructs you to switch that sequencing. Remember, sequencing is as important as having the absolute accurate code. Additionally, you do look for the organism that's causing the infection in the medical record, even if that means you need to go to the pathology report to find that organism. Of course, if you cannot locate it, it's not documented anywhere, then you go strictly with the site of infection or the infection, whether it be a urinary tract infection, pyelonephritis, cystitis, so on. The other thing to keep in mind with that, if we go back to the main term pyelonephritis on page 270 in the index, let's say your diagnosis written in the chart is acute pyelonephritis due to diphtheria. You could go under pyelonephritis and you could find acute as N10, and you could find pyelonephritis in or due to the diphtheria again. The one that supersedes or overrides the other code is actually the organism, or the A36.84. You would drop or not list the acute code. And in your handbook on page 148, where it says organism versus site or other subterm, and it gives the example of cystitis chronic and gonococcal. If your documentation would say that the patient has chronic gonococcal cystitis, you would actually go to cystitis and then gonococcal and code the A54.01 and drop the chronic term. The organism or any other subterm that is more descriptive supersedes the acute or chronic subterm, and you don't list this chronic or acute subterm code in addition to. You got to pick one of them. The next thing I'm going to talk about is bacteremia, sepsis, septic shock, septicemia, and SIRS. I would direct you to the first page of this chapter in the handbook where it indicates terms to know and what the definitions of each of those are. And as you move through from bacteria to sepsis to septic shock, you can see that it's sort of a hierarchical chart or listing as the disease gets worse. And because of that order, our coding changes as the patient moves through each of those infections as to what you code. So I want to refer you then in the chapter to pages 150 and 151 where it talks about sepsis, severe sepsis, and septic shock. These paragraphs talk about what it is clinically and then move on to how to code it. Now, bacteremia is usually indicates the presence of bacteria in the blood. It's usually transient, means that it clears on its own, and it's often not even coded unless that's all we have to code. Your book goes on to talk about urosepsis. Again, that is not sepsis. It's really a generalized term for urinary tract infection, so we want to be careful with coding that and what exactly the documenter or the provider means. Your book then goes on to talk about SIRS and sepsis and organ dysfunction and in what order to code those. So read that through. If I were you, I would write a step or a chart as to what order you should code these in. I think if you read, it's pretty straightforward. Coding and sequencing is listed later on page 151. Pay close attention to that as well. Under severe sepsis, it says the coding of severe sepsis requires a minimum of 2 codes. I'm on page 151. Sequence first the code for the underlying infection, followed by the code R65, severe sepsis. If a causal organism is not documented, you can code sepsis unspecified organism. An additional code should be assigned for the acute organ failure. So an example might be patient with pneumonia due to diphtheria infection causing respiratory failure. So our underlying infection is pneumonia. The organ is diphtheria. So you would look for pneumonia due to diphtheria, and if of course you couldn't find the diphtheria, you would add a second code with the main term infection and then diphtheria. And then your additional code should be for the organ dysfunction or failure, and that would be the respiratory failure I mentioned. The next topic with infection I want to mention is gram-negative bacterial infection. This is on page 153. Gram-negative bacterial infection is quite a severe, clinically severe case of infection. And if we do not know the type of infection, the name, but we know that it's gram-negative, either try to pick that up under the infection site, or you can go to the main term infection gram-negative, because that does talk about the severity of the patient's condition and additional resources that would be used or consumed by the patient because of a gram-negative infection. The next topic is drug-resistant infections, and these are important to pick up. We've heard for the last several years about the overuse of antibiotics and patients becoming resistant to different drugs or antibiotics. And it's important to pick this up if a patient is drug resistant to a certain particular drug, or the infection is drug resistant. Your main term to look up drug resistant in the index is drug resistant, and then underneath you can find a list of drugs that you would match up with what is documented in your chart. If the particular drug the patient is resistant to or the infection is resistant to is not found in the code book in the index listing, there are types of drugs or categories of drugs listed in your code book. You would need to research the drug that the patient is on to find that category or type, and then you could pick that from the index, again, if you don't have a specific drug listed in the code book that matches with your chart.